ahead and start. I'm gonna make a short video on root canal. I chose this tooth. These are some extracted teeth. Here's the pre-operative x-ray on this tooth, so you can see pretty wide open canals. I'd recommend while you're perfecting your skills, choose teeth that have visible canals. Don't pick the hard ones. So I've not instrumented this. No instruments have gone down there. So this is an upper molar. It's got a palatal root and I guess it's it's a lower molar. So 2 roots. This is the distal. You got 2 on the mesial. So usually the distal is the largest. I usually try and find the largest canal first. So you can see down in there, and I'm going to use this magnifying glass. You can kind of see. Can you see down into the canals?
Yes.
So there's like this black kind of pulpal floor, and it's kind of like a treasure map that leads you to where the treasure's at. And you can see it'll just guide you up to the corners of where that's at. And you want to make your access large enough, the opening into the tooth, so you can see it. So I can see there's a canal right there, right? So we'll call that mesial lingual. There's a canal right there, mesial buccal. And there's the distal canal right there, okay? Now, we're gonna have to get down those. I usually start with an 8 or a 10. I have an 8 in my hand. And what we were taught at our class is the canals are not totally straight. They don't go straight from the top to the bottom. So you put a little slight bend with your cotton pliers. You can see I got a little bend. You can kink it more, you can do different things, but I'm kind of looking at the shape of the roots. And so you would put some RC prep on your file. We have some of that right here. So put some RC prep on the back of your sponge. You don't want to put files into a tooth dry. So a little bit of lubricant, and you can just fill it, kind of makes it easier. Okay, so now we're going to go on the distal canal right where I can see an opening. And the way you can tell where the opening's at is you can use an Endo Explorer, which I think we picked it up and put it on others. So let's just say this is my Endo Explorer. So when you put it in there, you'll get a little stick, right? You can kind of see how that sticks right there over the top of the opening. And you just kind of memorize, okay, that's where it's at. So now we'll take our file. There you go, right where that stick was. We're just going to kind of work it. You kind of work it 180 and pull back. 180, pull back. I'm going to turn it over. You're going to see, there it comes out the end. And you can see the opening is not right at the end. That's the actual natural opening right there. So it looks like you're off to the side. You're not, if you took an x-ray, you go, oh, I'm off to the side. No, that's exactly right. Now, when you get right there, you want to do what's called smoothies. You want to go 20 times, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. And you don't want to pull back like that, because then you could lose the shape of the canal. So what you want to do is just see how it's hard to get back out there? That's what not to do. So now, because I pulled back too far, I got to find it again. It's going to take me a second. Not wanting to follow that path. Okay, there it goes. So I found it again. Now, don't pull back. Just really small. Watch how small I'm moving my hand. 1, 2, 3, 4, 5, 6, 7, 8. You don't have to be that far out the end. Maybe just this far, like a millimeter. But you got to be outside. So now, and if there's not a sinus, there's not a nerve, you can get a little bit bigger. You can kind of increase the amplitude. So that's what we call smoothies. You do 20 of those. Okay, I'm going to do another one. Again, this tooth, I've not prepared it at all. This is first time down on this. So you can see it's a little bit tight. So I'm going to rotate 180, pull up, rotate 180, pull up. And when you go down, don't force it down, just let it glide. You can see it's kind of working. It's getting close. I'm going 180. Don't go 360. That'll twist the end off. And at some point here, we're going to go out the apex. There it is. Okay, see it? It's right there. Just barely came out the end. Now, as soon as I feel that pop through, I'm going to do smoothies. And if it's a little tight, you can rock it back and forth. We want to go 1, 2, 3. It's a little tight. I'm going to rotate it. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. Now I'm getting up there, 19. Okay, now, still got a little catch. I'm going to go like 10 more. All right, now, and I can say, okay, there's nothing there I'm really afraid of. I'm going to go a little longer, and I'm going to rotate. See how I'm rotating 180? I'm going, all right, that's pretty predictable. In other words, I could pull my file out. So we're in what I'm calling the mesial buccal. I could pull my file out, clean it, put some more lubricant on it, and I could just go right back into that spot. And it should just go right down. See that? Just right to length. Because I did my smoothies and I established that path. So I'll show you on the distal. If I said, all right, I want to go down the distal then, I just want to check that. And I should be able to, this has got a little different shape. Right there, right out, okay, good. Look at that. You can see a little bit of, see that little bit of material coming out the end? A little bit of nerve tissue infection. That's what causes post-operative pain. We don't want to push any more than we have to out there. All right, now we got one more to go. You can see on this root, they're kind of like two, and they kind of come together. See that? They kind of taper and come together. So it's going to be interesting to see where the other one comes out. So one more time. Okay, there's the one I already did. He's coming out right there. Now, I'm going to move over. That's mesiolingual. Now we're going to go mesiobuccal. And get some more lubricant on. Zoom. All right, now we're going to go for this other one. Here we go. Twisting, 180, 180, pull back. 180, 180, pull back. And I felt it go out. There it is. I mean, that is so close. Let's put another file in just for fun so we can see how close those two are. But let's do our smoothies first. We don't want to lose that spot. So we're going to turn a little bit. We're going to go 1, 2, 3. We're just barely out the end. 4, 5, 6, 7, 8, 10, 11, 12, 13, 14. There's something about the 20, and you have to just discipline yourself to just count. You can't just do it 3 or 4 times and say, oh, that's enough, it feels okay. If you do it 20 times, I'm finding you won't get ledged or blocked out. If you shortcut, you're just going to pack gunk down there and you're going to be in trouble. All right, so I'm going a little long. I'm saying nothing in the way at the end. Not going to hurt for me to be out that end and even get some gunk out. All right, so, and then if I'm using my, we'll try the Root ZX here in a minute. I don't know if it'll work outside someone's body, but I'm going to try it. All right, so now I'm going to say, oh, let's just put that other file in and let's see where it comes out. Or if they intersect, we don't know. And I felt it go out. And it looks to me like they come out the same orifice. Look at that. Would you look at that, huh? There's one file. Here's the other file. There's that one. There's that one. See that? They both come out the same spot. So that tells me, just like the shape of this tooth, these two come down and then they exit in the same apex. Pretty cool. I can pull that one. I can push this one. Push this one down, pull this one back, push the other one. Same spot. All right, nifty, cool, awesome. Okay, so you could take and do a working length if you wanted to right here, x-ray, but really it's more accurate if you just have a Root ZX. So let's just throw one down the distal canal, which was a little bit bigger. I don't know if I can get down there. Okay, so there we are. So now all of them are out. Let's try the Root ZX. let's say if I hook that onto here, so it's touching my skin, and I hook, if I touch that, will it give me a reading? Probably not unless I bury it into my finger, which I'm not willing to do. So anyhow, on the RCT ZX again, this is just relative, but you're going for right there, which is, you can call it a 0.5 millimeter from the apex, and it'll also tell you when you're at the apex. Watch my other video and you can see that. All right, so now I'm not gonna bury it into my finger. So now we've got all that. So now we're gonna take these out. We'll only use them to confirm patency. And now we're gonna go to our rotary files. So we're gonna start purple, yellow, and we're gonna finish on gold today, but you could go to red if it's a bigger canal. So I'm gonna go and just put, I'm gonna put some more, of this lubricant because a lot of times I'll use, some of this RC prep at first. Later on, I'll definitely put sodium down in there and just mix that all together. All right. Be on here. It should be on. Okay, on the Pro Mark over here, so I'm using this setting, which is R4. So it's a Pro Taper Universal. This is a Shape 1, and it's going to be the finisher one. It's 300 RPM, 500 on the torque. Okay, so 300 RPM, 500 on the torque. So watch how amazing these files are. I'm not going to worry about setting the length, but you'd set it to the length that you determined, right? So most people hold it like this in a pen grip with this finger on there. The problem with that is you have a tendency to push down like that. That will break files if you push it harder. So you want to hold it like this, just kind of cradled, and you actually want to lift your index finger off. So they say it's a cigar hold, but since I've never smoked a cigar, I have no idea what that is. But so just like this, and what you're going to do is it's just going to follow. It's going to follow your path. Look at that. There it is, out the end. So that rotary went down just like that. So I can probably set my length here. So top of the stopper is about the length. And that's it. Once I'm down, I'm done. So I can go to the next one. I'm just letting it go down and I'm pulling it up. It's kind of follow down, feather up. We'll watch it from the top here. You'll be able to see you hear the handpiece saying, oh, that's pretty good torque there. Looks all right. Let's just confirm that we still have a open patent canal. So again, I'm going to run my file in. Yep, that looks good on that side. Go on the other side. Yep, so that's open. All right, easy does it. Already did the distal, which is that one. So we're going for one of these mesials. Nice and easy, just let it work. So not pushing it, just let it work. Saying, well, it's pretty tight down in there. So I'm going to back out. I'm going to make sure, okay, file goes right down. So maybe I'll do a couple more smoothies. And I'm going to do the other side. Both canals still open, still patent. Clean off the flutes. If you get this full of gunk, it's not going to cut. So you want to make sure these stay clean. All right, let's go again. And there it comes, at the end. Or maybe that's the distal. That's probably the distal. Oh, yeah, it is distal. All right, that's distal. This is what we want on the meso. Here we go. Maybe this time. Again, I'm not putting my index finger on it, just letting the file do its work. It's saying, well, at the bottom, it's a little complicated. And I think we broke a file. See that? Broke a file. That'll make a good video. So, it was warning us, you're pushing, you're trying to make a nice video. Right there, broke a file. All right, so, maybe you can learn something from that. All right, so the other one is still open. And what I'm gonna do, which is what I probably should have done on the other one, is go to bigger file. Do a smoothie with a bigger file. So this will be a good comparison. So I'm going to take a 10 and do the same thing. And say, okay, I'm out the end. Let's go. 1. Yeah, that's tight. 2, 3, 4, 5, 6, 7, 8, 9. You can see it's getting easier. 10, 11, 12, 13, 14. 15, 16, 17, 18, 19, 20 smoothies. What's up?
Nothing.
Oh, we're just playing with teeth here. All right, so now I've got a 10 that goes all the way down. And I know it's a tight canal. I'm thinking, you know, I could go rotary, but there's a chance I could break a file. Funny thing is, we just did that. So let's take a longer one down. Let's go 15. We know it's going to be tight, so we'll take it. Same thing, rotating back and forth. Kind of tight. 180, 180, pulling back, getting debris out. 180, 180, 180. Feels like we're going down farther, which is good. It's so hard to hold on to. I got all that stuff in there. And there we are. We're out the end with 15. So while we're out, what do we do? Smoothies. It's really tight. So smoothie time 1. Oh, it's tough. 3, 4, 5, 6, 7, 8, 9, 10, getting easier, 11. I'm twisting about a quarter to 180. It's going more. You can see it's coming out the end. See it right there? I think that was 10, 11. Twisting. Come on. It's like, I know it's a kind of a curvy tight canal. All right, come on. 17, 18, 19, 20. Okay, so now we're going to be able to see the difference. See, I can take that 15 now and I can just go right to length. Not too bad. So I have another purple file over here. So let's take purple again. Ah, patient ran away. We coaxed him back in the chair. Okay. So let's go purple again. I'm going to go down the distal canal just for, okay, there's distal, goes right on out. We know one of these is blocked. That's mesiolingual. So now we're going to go down the other one. So same thing, just let it fall. Take my index finger off. Same kind of hard. All right, so it's warning us. So instead of breaking a second file, let's go to a 20 hand file. Well, 20 goes out. Let's do, this is kind of a good tooth to pick. smoothies on a 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 15, 17, 18, 19, 20. All right, so 20 files all the way out. The other canal we know is blocked because we forced it. So yeah, you may have to do a little bit more hand filing on harder teeth, but that sure beats breaking the file and having to refer a patient. We're gonna clean the flutes. And we got enough lubricant in there. And we're gonna see if it'll go down. So it's still pretty tough. Broke again. Wow. We're having a good time today. Well, maybe we'll just do our distal canal. All right, there we go. White goes down easy. Yellow's where we finish. It's all good till I started to try and hurry and push those files. Yellow's what you can finish with, so you see yellow easily goes down. Red for larger canals, distals, different things like that. And right down she goes. So. Again, I would just go to the length that I have for my working length. I'm going out the apex a little bit so you can see. So didn't transport the canal, got right down there. The mesial was tough, probably because it intersects. Could have done a little bit better by just doing more hand files, maybe even have to get up to a 20, 25 hand file, and then just slowly working those files. All right, video is over. We'll do another one later.